Wendy, you want to go ahead and just get the roll call for the commissioners, please?
Okay. Is Allie on? Allie Nestat?
Hi.
In person.
Oh, in person. Okay, awesome. Anna Davis,
I'm here. Thank you, Anna.
Barbara Moore,
I'm here.
Benita Cooper,
I'm here.
Christina Poosh. No, not here. Okay, Cliff Mitchell.
Hopefully Cliff will join us.
Yeah. Jacob Benzikin,
Present.
Mangela Paul,
Good morning. I'm here.
Nadia Hutchinson.
I'm here.
Good morning, new commissioner.
Thank you.
Nicole Hart. Not there yet. Okay, Paula Montgomery
I'm here.
is present. Ruth Ann Norton is present, and Susan Kleinhammer.
Here.
Okay, last is Nicola Tran. I don't know if she's sworn in yet or got a letter. Let's see if she's on.
I don't
No,
know.
No, she's not on yet. Okay.
Well, we'll
And Cliff
appreciate-
Mitchell just joined in person, I see.
Wonderful. Fantastic. Thank you,
Okay.
Cliff.
Morning.
All right. So we are
Oh,
going to
Paula. I'm sorry,
Yes.
Paula, who's sitting next to you?
Harry Johnson.
Harry Johnson.
Okay,
here.
welcome. Yes. I
Thank
hadn't seen you
you.
before, so welcome. Welcome, everybody.
Fantastic. Thank you, Mr. Johnson, for being there, and to everybody in the conference room for being in person. As I said, I got called to do some duty on behalf of our EPA Thriving Communities Project. So I'm in Charleston, West Virginia, calling in. We're going to take a look at the minutes. Hopefully everybody had a chance to read the minutes. And Wendy, if you want to, we'll put the agenda up in a minute, but if
Yep.
everybody's, I have a hand from Paul here. Is it Paul Rogers?
Yes, I am here. I want to introduce Michael, who's going to replace me. This will be my last meeting. Mike is going to replace me from the MDAAP. And Mike has done a lot of work with me on a lead poisoning toolkit, on a grant and so on that we had. But he's going through the process now of getting certified and appointed by the governor.
Well, Paul, first of all, I think we've said this before, and I know probably Cliff and others want to say this, but what an amazing commissioner you've been, what an amazing partner in the fight to eradicate lead poisoning and care for our children. We hope you still stay involved. We know you're moving off the chair, and we want to welcome Michael. Is he online to introduce himself?
Yes, I'm here.
Would you like to say a few words about yourself, Doctor?
Sure. My name's Michael Ikniowski. I'm a retired pediatrician, but I've been active in the Maryland chapter of the American Academy of Pediatrics and Environmental Health Issues for quite some time now. Paul and I did work together on a number of lead-related issues. We presented an echo program to pediatricians from the chapter, I guess about a year and a half ago now. So it was good working. I've worked with Paul for a long time on the committee as well. I also do work on climate change with some other advocates from the AAP nationally, and I do work on pesticides and other chemical toxins that through work with the Maryland Pesticide Education Network as well. So it's nice to meet everyone here. I know some folks from other things that I've been involved with, so it's good to see everyone. And
Michael, where are you located?
I live in Lutherville right now.
Okay, great. Okay, fantastic. Good Baltimore County representation going on there. That's
Yes,
Suzanne.
Yes.
Hi, Cliff. Let me just say, if I may, point of personal privilege. First of all, Paul, thank you so much for all of the help over many, many years, both on the commission and also informally. Paul and also Mike have been my go-to people for physician input on clinical guidance for providers. I've worked with both of them on the ECHO project, doing outreach. They have really been at the leaders in the pediatric community in trying to get pediatricians to be aware of lead and other environmental hazards and to improve and increase testing. That project, which was incredibly successful, worked with a couple of practices and saw marked increases in their lead testing performance as a result of the work that they did. So, Paul, I'm going to miss your wise counsel on this commission, but Mike, it's great to have you aboard.
Thank you.
And very, very much look forward to talking with you, not only around the lead issues, but how we're looking at carbon emissions and a number of environmental justice issues that relate to environmental health. Can I just ask quickly before we go to the minutes, could everybody who's in the conference room just introduce yourselves so we know who's there? And I saw a hand go up from MDE as well.
So yeah, I just wanted to make sure I recognize that Senator Mary Washington just joined us. So
My God.
Mary, I'll start with you and we can go around the room.
And Senator, this is Ruth Ann. I have to call in today from Charleston, West Virginia. I am so sad to miss you and Carol Ann and others that are there, but thank you so much for getting a presence from the Senate. And anyhow, please introduce yourself. We are so glad to have you.
Absolutely. Good morning, everyone. Senator Mary Washington. I live right here in Baltimore City. I apologize. I got stuck sitting behind a truck and I realized it wasn't moving. And I guess they were delivering something. I went around it, so me and like 15 other people were just sitting there and I said, this doesn't make sense. So I apologize for being late. I won't be. And because this is my first meeting, it was really important that I be here in person. But as you might imagine, there will be times when I be a remote. I represent the 43rd Legislative District. I've been in office. I was first elected in 2010, served in the House of Delegates, and then won an election and became the senator for the 43rd District. I currently serve on the Education, Energy, and Environment Committee. I've known some of you, and particularly Ruth Ann, in my other job that I had prior to being a legislator, and I'll mention Mr. Banks and I worked. I was with the Parks and People Foundation, associate director of the Great Parks, Clean Streams, and Green Communities. And Mr. Banks and I, when he was at DNR, started the Civic Justice League, which is now the Conservation Corps or something like that. Okay, so way back in ancient times, that we did that, and so my just overall interest and commitment to public health. Oh, also my background is in public health, PhDs, sociology, Hopkins. So just that, and then also in that capacity. All right, the Sustainability Commission was also where Ruth Ann and we were founding members of the Sustainability Commission. See, if you're around enough, you get to say that founding. But we're still here, as someone told us last night.
Well, Mary, thank you so much, and we are going to benefit so much. We know that during the legislative months, you won't be able to join us in person, but we appreciate that there'll be a partner there to convey important things. And I still think of you as just a young person in the whole thing.
Can't hear you.
Oh, can't hear me.
Don't leave the call.
Don't hit that button.
That's how we got.
That's how we got back on. I think we're gonna have to get off and get back on again.
Was that ours?
This
It's
is
here?
us, yeah.
Yeah, it's us.
Hold on
Okay.
1 second, guys.
Yep. Sorry, guys. We'll get to the meat of the things in just a minute. We do have an EPA person on board. While I'm doing this, I'm going to remind everybody, but if you know anyone who is interested, is working on environmental issues in distressed and disadvantaged communities throughout the state of Maryland, I want to just remind folks, our portal is open for grants. If you know any organizations, local governments, universities that are working on these issues, ghhi.org/thriving communities. Our I'm going to say this when everybody comes back, but just a reminder that we have grants ranging from 150,000 to 350,000.
Camera didn't pick up.
So just to remind people to share that.
Maybe if you turn the,
All right, Ruth Ann, we're back, but now you guys can't, looks like you can't see us.
if you turn the camera off maybe and then turn it back on.
Where is that?
It's next to you,
Down the bottom,
right underneath the roof.
microphone.
Right here?
Right there.
Okay. Senator Washington, the first act of being a member of the commission is get funding for technology for MDE.
Sorry. Oh, wait a minute there. I think we got it now.
There you go.
All right.
Okay, all right. Okay, so we went from
This is
Senator,
actually the nicest.
Senator Dr. Mary Washington, who's to her left. Is that Nadia?
Yes.
Nadia, you want to just introduce yourself again?
Okay.
Just quick.
Okay, hi everyone. My name is Nadia. I swore in last week, so I'm really grateful to be now sworn in commissioner. I organize with Young, Gifted, and Green as our Baltimore organizer, and I also hold the Be More Just Transition Network, which is a growing network of folks committed to racial justice, climate justice, and environmental justice. We're approaching 100 people, and we started in March, but I feel like the work is kind of predicated on Baltimore People's Climate Movement. And Baltimore People's Climate Movement was organizing during the first Trump administration and came out of the People's Climate Movement. But during COVID kind of like fizzled out.
Yeah.
And I was one of the lead organizers for Baltimore People's Climate Movement. So excited to like bring back together that energy and build coalitions. One of our main focuses has been trying to get smaller organizations more capacity through coalition and like getting folks to know each other, decreasing duplication and increasing efficiency.
Thank you. And has been just an amazing leader on the lead service line work in Baltimore, organizing with members of our Maryland Climate Corps. I think Dr. Mitchell is next to you.
Yeah, Clifford Mitchell. I'm the director of the Environmental Health Bureau at the Maryland Department of Health. Nice to see you, Senator.
Good. And going around the bend.
Fred Banks, program manager for lead poison prevention program here at MDE.
Great.
Hi, Dr. Caroline Gross Davis. I'm an epidemiologist with EPA. And I work currently now in the new environmental justice and in community health and environmental review division. I can never remember the whole. So basically the OEJ ECR division. And part of my work is cumulative impact assessments at the national level, pushing that concepts forward as an exposure scientist myself. But also a lot of my work has been on lead. And that's kind of where I'm here today to talk about some of the new things we're doing in Region 3 and some of the partnering that we're going to be hoping to help move this along, especially around screening.
Fantastic. Thank you. And we'll come back to you and look forward to that.
Yeah.
Allie?
Hi, I'm Allie Nesta. I'm the parent advocate.
You are amazing and you're wonderful to be there. And then Allie, is there anybody to your left, right?
Yes.
That would be me, Paula Montgomery. I just want to let everybody know that this will probably be my last meeting with the commission representing MDE. Dr. Banks will be taking the lead, but I have assured him that I will continue coming to the meetings and being any type of support that may be needed. So it's been a long time. Ruth Ann and I have known each other for
33 years. Yeah.
Yeah, very, very long time.
Are you-
So it's
Paula, are you retiring?
no.
Okay. I didn't know if
At
that's what you
some
were saying.
point,
Okay.
but I have a son in college, so that's not going to happen anytime
Yeah.
soon.
Okay, good. I didn't know if that's what you were announcing. Sorry about that. Didn't mean to put that.
No.
Okay. That's great. And is anyone next to you, Paula, or is that it? 'Cause we can't
Yes,
speak it.
My name is Carrie Johnson, and Ms. Norton, I have met you a couple times via Zoom. And
Yes,
so I'm a resident of Baltimore City, and I moved back to Maryland, to Baltimore. I grew up in Montgomery County, and I left San Francisco 2 years ago and moved out here. I'm inspired to help close out the lead paint issues here in Baltimore's housing. I have a background in architecture and construction and am in research and development phase and learning how to put a business together. And Ms. Norton, I have been circulating, meeting some new people, and I've found my way back here. So I've been on these calls just listening,
yes,
and I decided to come in today.
fantastic. I'm so sorry not to be there to see you today.
Thank you.
We are trying to give away $40 million across Region 3. So, is anyone else there?
I'm the last.
Okay, great. We can't see you and Paula, unfortunately. So Wendy,
No worries.
let's move to the adoption of the minutes. Please, if all have read the minutes, are there any comments around the minutes? See if there are no comments around the minutes, no amendments to the minutes. Can I get a motion to adopt the minutes?
So moved.
Can I get a second?
Second.
Okay, we have Wendy, all in favor?
Aye.
Aye.
Aye. Okay, anyone abstaining or not in favor? All right, we have a unanimous adoption of the minutes. I know that everyone will read them again for your sleepy time tea on Friday night. So, but do pay attention to them. They are part of our formal record. We have some new members in the room. We are so glad to welcome them. Wendy, you wanted to go over the appointments updates. I am in progress, Wendy, with Tisha Edwards at the state. So that may be an update for you, but I don't know who else you wanted to update.
Okay, yeah, I just up on the screen is our membership list, and just wanted to go through and get some updates and provide some updates. Welcome Senator Mary Washington, and which is our new appointee. And let's see, we have pending appointment Nicola Tran, I believe is still pending. I think she is on the line right now. Let me.
Yes, I'm here. We're waiting for the letter of recommendation, I believe.
Okay. So that is pending still then. And Nicole Hart, did you swear in? Is that finished?
She did.
Okay, she did. Ruth Ann, had you gotten your application in yet?
It's in progress.
Okay. And then Dr. Michael, oh my gosh, how do you pronounce your last name again? Iknowski?
It's Ikniowski.
Ikniowski. And were you able to send in your application yet?
I haven't received it yet.
Okay. Did you get the link that I sent you to send in your application?
I don't think so.
All right, I'll try to resend that to you, but it's a link you can go to and fill out an application for the to get appointed.
Okay, thank you.
Yeah, no problem. If you can put your send me a message in direct message if you can in the chat with your email address, just to make sure I have the right email address, that'd be appreciated. We do have one vacancy now, representative of owners of rental property built after 1949. If anybody has any recommendations, please let us know. That position, I believe, has been vacant for quite a while. Nadia Hutchinson, were you able to swear in yet?
Yes, I was. I swore in last week.
Okay, wonderful. Barbara Moore and Anna Davis are both pending appointments.
Any idea when? Like, should we be just expecting an email someday?
Okay.
Barbara,
I keep checking, but
yeah.
Okay.
Barbara, we'll follow up with Secretary Edwards' office, and I know they were, they have this in their eyesight to get us at 100% and get that process. One request to Senator Doctor or Dr. Senator, how I do it, Mary.
I heard this coming, yes.
Maybe I just call you Mary.
We're good.
There you go. We are still pending a representative from the House of Delegates.
Yeah, I was looking at that. I'll find someone.
Yeah, so
Perhaps
we
you
would,
could tell me what other jurisdiction other than Baltimore has sort of the highest concentrations,
we
or the biggest challenges around, this.
I would say a couple of things, and Fred Banks
Or
may
like a
want to say
rural
more,
area.
but we have rarely had like rural Western Maryland or the Eastern Shore represented by delegates, and that would be very helpful.
How about Charles County?
Charles County, I believe, has, I'd like to look at the data with Fred, or have you look at the data with Fred Banks.
Yeah, it's low.
It's low.
It's relatively low, but
I was just thinking about the rural. I know.
so I would,
Project would be great.
Washington County.
Yeah, it would be great.
Washington County would be spectacular.
Oh, yeah,
They've
Washington
had a
County.
large number of very challenging cases. Cumberland, Allegheny, but particularly Washington
Frederick and
County
West.
would definitely be, Frederick and West, except Garrett.
Yeah.
Yes.
Okay, I'll look and see who serves in that area and.
Yep, and I would also say to our environmental health people, our property owners, and our advocates, to also reach out and get engagement, and we may have engagement for the participation and in our efforts here. Okay, thank you.
I've got a name, and I don't know how it goes. If you ask for it, et cetera, I can tell you a name right now.
Okay, go ahead.
So Frederick County, Kenneth Kerr. So he's in District 3 in Frederick County. And then I would say, again, a rural area. I just say this, I know she's from Charles County, but she's very much mindful of rural Marylanders. And this would be Edith Patterson, District 28. And you let me know the process. I know both of them well, so if I can help.
Yeah, and if you would take a look at Washington County and just look at the data, and then we'll finish the rest of this offline. We appreciate that. And thank you for call you on the spot on it. Thank you. Thank you, Wendy, for this. Let's move on to the next.
So the last one is Alexandra Nestad. Did you swear in yet?
I did.
Okay, wonderful. Yep,
Yep.
that covers everything.
Thanks.
All right, if we could move our 25 calendar, can we just distribute that, or is there
Yep, I sent that in, and these are the upcoming dates for next year. If you guys are still in agreement, taking a break for July, August, and December. I don't know if you want to discuss that in January, but this is just, as an FYI for now.
Okay. And December is one that we hold in case we need to meet. So if anything comes up prior to legislative sessions or anything else, but we can revisit that. But any comment by commissioners on the calendar or otherwise we'll move on. Fantastic. Now I'm really, really, really happy to say a couple of things and then get to Dr. Carol Ann from EPA. But one, I just want to say that I know that with the election, there is a lot of concern.
Oh, crap. We lost you. Hold on 1 second.
Oh, God. Wendy, we got to get this fixed.
Yeah, I told, I emailed Cliff. He's hopefully going to give the message to Paula. I think the issue is with the log on. So if Paula tries to log on as herself, or Fred, even for that matter, they might not have the issue.
Okay.
And then I did provide them also a call-in number. So if last resort, they can call in on the phone.
Yeah, just in general, the technology for the conference rooms.
Are we back, Ruth Ann?
You are back. So I'm going to keep going. And I appreciate everyone's patience today with the technology issues. Can you all hear us?
Yes.
Okay, thank you. I know there is a great deal, I've talked to a few of you, a great deal of trepidation about what will happen moving forward on a federal level with regard to the issues of lead. We are very grateful that both DHCD and the city of Baltimore were recently awarded significant HUD lead hazard control grants. We have had a number of really good EPA grants in the state working on the issue of lead education, lead in water, lead in paint, and we've had a number of health initiatives. I think we, from a standpoint of my own organization, we are preparing drafts for the new administration for consideration to continue programs, to enhance programs, looking at the economic analysis. There is some concern around, of course, health plans and what will happen with the Affordable Care Act and the coverage for various things, or for waivers or use of children's health insurance program monies. We will be advocating all of these things to stay in place. They did mostly certainly from the Office of Healthy Housing, remain untouched and in fact increased during the last Trump administration. So we are hopeful that we'll be able to navigate those waters based on the common ground of children's health, of neurological health, and of the case that has been made. GHHI will be convening a number of transition statements around these issues. And if you are interested in joining GHHI, I don't know what the state of Maryland will be doing with regard to any pending transition matters, but I do want to say we are continuing to look forward on the mission. We know in the state of Maryland, the candidate that won wasn't the state's, didn't win in the state of Maryland, but they're still moving forward as the next administration that we will endeavor to represent families. I am so proud of the great work that the agencies have been doing, and especially has been just an immense benefit to this country, the work that is done by the Environmental Protection Agency, ranging from their RRP rule to the extensive lead and environmental justice work. And in the course of our work on the Thriving Communities grants, which are still open and available for Region 3, $40 million of grants ranging from $150,000 to $350,000 for communities working in EPA's disadvantaged community. You can find on the disadvantaged communities map, part of the environmental justice and Justice 40 work. We encourage you to share this through all of the different work. Nadia's doing such a great deal of work on the Baltimore Just Communities work, but all of the work that we know in community organizations that can apply in Maryland, we urge you to share that link, ghhi.org/thriving communities. And to that end, in the course of this, Carol Ann has been gracious to come down and talk to us about the work she's doing in environmental justice, environmental health. So I'm going to turn this over, and we are so glad to have you today. Thank you for taking the time to come to Baltimore.
Thanks, Suzanne. Wendy, do you have my presentation? It's going to be small for me to see it.
I do. Here it is. Do you guys see it?
Better. Thank you. Yes. So again, Carol Ann Gross Davis, Region 3 in Philadelphia. I've been at the agency for over 33 years. So I've been here a long time. I did all my graduate work while I was working, both a master's in engineering and then a PhD in EPI at the School of Public Health at Drexel. Yeah. So I've really when I do all my work, I was there with data and all the kind of missions that we've been doing at EPA. And so I've worked in pretty much under every statute at EPA at some point in my career. And for the last more than a decade has really been on non-regulatory work focused on exposures, children, and public health, right, at the agency, and really bringing science back into the work that we do for public health practice. Like really trying to kind of, so I've spent a lot of my time with the Office of Research and Development. So we'll talk about a little bit of that today. And Cliff, I know you from ethylene oxide.
Oh, yes.
When I used to be in air toxics. So I've done lots of different things. So right now I'm now in the office, the Environmental Justice Office, to really support from that science perspective, that there's science to show us that these non-chemical and chemical stressors together have disparities and don't impact everyone the same. So, all right, I'll get started. So next slide, please. So today I'm going to just touch on a couple of the lead things that I got from I'm not a lead expert in water, but I used to do water for a long time. So I'm going to update that and the Get the Lead Out program. I'm going to touch on, and Cliff, you might have already seen this presentation, a part of the hotspot mapping. So I'm going to introduce the stuff that I'm doing in West Virginia. That's pretty exciting. And I'm also going to touch on the new MOU that Region 3 did, and it is nationally with EPA, HUD, and the CDC, right? So I'm going to touch on that because I think there's some huge opportunities on data integration and standardization of lead, right? Can we get a lead data? And then again, I'm going to touch on some novel projects that, you know, Ruth Ann is aware of, and so is Cliff, about increasing blood lead testing. Next slide. So finally, October 30th, it was published in the Federal Register, right? So the final lead and copper rule improvements have been officially published. So there's the link, but this means the clock starts, right? So when the rule was finalized October 8th, you know, so it hasn't changed, but now the clock starts. So with that goal, next slide, please, of trying to get kind of 10 years to really get these systems to get their identify and replace, right? So I think it's an opportunity to really talk about this kind of lead that we kind of pretend that we kind of fixed it a long time ago. And I think some of the challenges we have is the national data. If you look at Ed Haynes, it looks like we fixed it, but we did not. Right. And I think as a federal agency, I'm also very optimistic because the federal lead action plan did start under the Trump administration. So I really feel that this is a topic that we can get a lot of energy. And so I think I'm excited about that. And again, this is based on science, right? We're kind of really trying to get these improvements out. Next slide. So one of the things that's exciting, and I definitely did my research on why are they doing this? And partly from this changing the sampling is I've been doing work in Clarksburg, West Virginia, where we also had a very similar Flint, Michigan experience where they changed the water system with no corrosion control. So I've spent as the EJ kind of public health person connecting with the medical community, trying to really get, how do we get people to use the pitchers? How are we sampling? How do we know kind of what, you know, is this improving, right? And so one of the, I think, really great things is they took the lessons from Flint, Michigan, and are changing the way. So we anticipate that we're going to find more systems that exceed the lead action level. And at EPA, and I want to say right now, we have a new division director, Dr. Leslie there, I think is her name. She has a very long name, but she is our new division director, and she just came from the Office of Water. She was the deputy director. So she's very focused on kind of the EJ perspectives and how do we react. So we're trying to plan now. How can EPA support when we're going to find these exceedances and not kind of have it be this slow reaction time when we start to see these exceedances, right? So we're kind of gearing up to try to support our local partners on that. Next slide. So again, one of the things that the trigger has changed, right? So this is kind of something I think that's exciting that they're lowering it down to 10, right? So again, not only are we increasing and changing the sampling, we're lowering that action level, right? So I think that's a really critical piece so we can actually react quicker, right? And so we're looking forward to kind of seeing that. Of course, it's going to take, as all federal rules take, it takes some time for all these things to really be enforceable. But one thing is, again, trying to notify the public, really conduct public education programs. And that's something, again, I think all of us know that sometimes we're not connecting. We're not talking about this in the same way, that people aren't taking actions to protect themselves, right? And so that's a risk communication challenge. And then again, even though we're really hoping, again, how can we expeditiously replace all these lit service lines? And the first part is to identify them, right? So I don't know how Maryland, was everything submitted by October 16th? I don't know. Next slide. And again, this is something that I think is going to be important, and even from an EPA perspective, how are we going to communicate where these lit service lines are? One of the concerns we have too is once you start replacing them, you're disrupting the system, right? And so how are we going to communicate to people kind of where these things are happening, what to do, and really make sure we're telling them in language they can understand of how to protect themselves, and don't use hot water if they, all the things that we need to do that are we know we have that information, but we haven't been connecting to people to actually take the right actions. And again, looking at to make sure corrosion control is effective in the system. All right, next slide. So as I'm sure you're aware of, I know Bill Richardson was here last year, I think last December, who talked about kind of the updates on kind of the lead and copper rule improvements. So the technical, assistance is still available. And so on you can go to the next slide. So we have, I think, only the states that the only communities that were picked on those initial ones were in Pennsylvania. But there's still, some additional technical assistance. And I can tell you firsthand, I'm working with water systems in West Virginia. So I know really a lot about water systems that only serve 350 customers, right? This is a challenge, right? So please, try to connect folks to the technical assistance. And I think another thing to think about connecting to those community grants that Ruth Ann was talking about. One of the things from my perspective and folks in my office is some of this lead remediation those grants can be used to do that, right? So it's a great opportunity to match communities with monies that can actually change and actually make a real impact. So it is eligible for some of that work. So I think we, again, have a real opportunity to make differences at the community level. Next slide.
Can I jump in there just to
Yeah.
say, for all of the counties, and Cliff and, speaking to everybody here, but for all of the counties, like, for example, Washington County, local governments can apply to the Thriving Communities Program. They could, if they, I can't tell them what their application would say or anything like that, but they would be eligible to put in for $350,000 for implementation, to clean up homes where there are children or risks. Community-based organizations, they are at the heart of what we're trying to do is build capacity there. So throughout the state, working on any lead work around assessment planning or implementation. Caroline is exactly right. These dollars are available for lead remediation and healthy housing. So let me stop there. Just wanted to reemphasize that because we're really wanting to make sure that we give great access in rural communities and communities that are often not heard at the community level, and give an opportunity to build that capacity to get started or advance, and they'll get a lot of technical assistance with it as well. So
can I ask a question about this section? Community organizations that are not necessarily government entities can apply for the money that you're talking about?
It's intended for community-based organizations as a priority to build capacity of those organizations. Yeah.
Right. So to build the capacity, and then health departments, then local health departments,
local government,
working with a local nonprofit to build a capacity. I'm not as familiar with these grants. So.
We're happy to set up office hours to talk to you.
We lost her again, but I will say majority of all the money that came out of the Office of Environmental Justice and Civil Rights was connected with CBOs, community-based organizations. We had different rounds. Some were for states, they have passed. And I think for the ones that Ruth Ann's talking about, there is some opportunities for really kind of rural, because again, building capacity, but it's really focused with partnering. So I think it's, that has to be a large piece and typically it wouldn't.
Can anyone hear them? People at the conference room, your audio went out. I think you're, Wendy.
I think they left the meeting. It looks like they're going to probably try to get back in. Yeah, they're not.
Wow, this is just annoying.
Yes. They're either going to try to call in because I gave Cliff the call-in number.
Well, we need to invest in whatever it is in the conferencing technology so you're not dependent on somebody's laptop too.
Hey, you guys hear us?
Yep.
Yes.
Yep, we can hear you.
Echo.
But we're looking at the ceiling. SNL's not till Saturday, guys.
Yeah, so, yes. All right, we now have backup for the sound.
Okay.
Fred has arranged.
So
Great.
Senator, did that answer your question?
Yeah, yes, you're good. You're
I
good.
have a quick question. For the lead service line inventory, do y'all have like a first round of data of like how successful that inventory process has been, maybe more nationally?
And Nadia, is that you? For purposes of the minutes, could people asking questions please identify themselves?
Yes, and this is Nadia.
So your question was, is it going to be, are we going to like do an analysis nationally to see, say, how much did we get?
Yeah, or even just like how municipalities and water supply systems dealt with the inventory and like lessons learned from this first inventory process.
Well, I will say, at least in West Virginia, I know we are, because West Virginia has agreed to give us all their raw data. And we're going to map it for them, and we're going to give it to them at the point of actual addresses, because we're going to combine it with some of the other work that we're doing. And so one of the concerns we have, right, there's a lot of unknowns, right? So I think there's going to have to be more discussions, because that was allowed. You could just say, I don't know. So I'm curious to see what percentage of these inventories are I don't know, and what communities does that look like, right? I expect the rural community, there might be a lot of unknowns. I looked mine up yesterday because I live in the city, but mine's underground, so it was an unknown, right? And so that's a great question, and I think that's part of the transparency, because the lead service lines have to be made public. Right. So I think how are we going to respond when people now know that they have lead service lines on their block? Right. So I think there's going to be it needs to be more opportunities.
Oh, thank you. This is Paula Montgomery. I do have a question, because I think, I'm not sure that, since the Flint, Michigan thing happened, but is there a multi-level approach when you're doing these kinds of studies on water lines, like not just looking at the water lines, but looking at the built dates of the property, looking at, exposures in the areas, or is it just looking at water lines?
So I'll talk about that a little later in the
Okay, because I'm just wondering that.
It's complex, right?
Right,
We have a water system in West Virginia that has no lead service lines, because it's all in the solder.
Yeah, right.
Because they didn't have corrosion. They switched their water supply. Right, this is a very common opportunity, and it was not in the lead surface lines. They will replace them. So we had ORD, we were taking sampling, and there was pieces of solder in the filter, in the faucet.
Oh, yeah,
chunks of it.
Yeah.
So again, so we're really trying to, there's just a lot of chemistry that's involved with even how to make sure the corrosion control you're doing is effective, right? So so part of the research we're doing is trying to really be nitty gritty on that science. And our Office of Research and Development, in combination with all the money that was going out for lead, is also literally doing that work in Sentinel sites to try to optimize how to be a little bit quicker, right? How do we kind of figure out what's the best way to do corrosion control? But because again, based on cost, based on size, not everybody can do kind of like what the city of Philadelphia can do, right? Because it's such a large water system. So there's definitely research happening on that, but that's a great question. And that's some of the research that we're doing, is trying to look at all these sources, because we have lead in many areas that we still permit, right? And so we have not done primary prevention for lead exposure, except for paint. Did I answer your question? We'll talk a little bit.
No, I mean, I'm just wondering because I mean, Cliff and I have been doing this for a very, very long time. And, you know, and what we've done over the last 30 years is that, you know, even though the Flint, Michigan had brought, you know, to the country a very, you know, a problem that needs to be addressed, you know, we're still seeing with our data that housing is a main issue. And I'm just wondering if, you know, a lot of these water studies are looking at, you know, a comprehensive approach to eliminating the problem.
Well, I think that's one of the things that when I show the research that we're doing is we know that based on all the research, right? Because we don't know, we don't have like a you know, biological test that says this lead that you have.
No, right. Comes from
There's
this.
some research on that, so I'm hoping those isotopes really.
Yeah.
There's some grants out there to really look to help identify what's the main source of that lead. So I hope we'll get there somewhere, but I agree with you. Lead paint is still kind of the number one when these investigations happen. But when we think about knowing that we want to remove all lead, this is a great opportunity because depending on if you have housing and, you know, it's this combination too that makes us.
Agreed.
So I totally agree with you.
Okay. And I agree with that's good though. If we have the money to get rid of them, let's do it, you know.
Well, and I think it really goes to this cumulative impact approach, right? Because, you know, Carolyn, there's no doubt paint and housing's been the overwhelming source. And I don't know that we actually have any children ever documented for water as primary. But spices, I mean, we have a whole bevy of other sources. So this is extraordinarily good that we're looking broadly, but clearly on the collateral damage piece, lead and water is a major threat. Yeah.
Yeah, and so if we go to the next slide, it should go right into my research discussion, which we'll talk a little bit more about kind of this all of government approach. Next slide. So there's a couple papers that ORD has been working on, really trying to, how do we use lead mapping? How do we use all this exposure data we have? How can we better utilize this, right, to help start to chase the exposures, right? Let's look at where these exposures are happening and not waiting for someone to be ill, right? And so this is kind of a lot of the focus that we're trying to do. Next slide. So here's an example, Paula, of kind of all the different types of data. So at the top right, that's the HUD housing index.
Good.
So that looks at the, you know, risk of deterioration of paint. You can see kind of the differences. I can't see, obviously red is worse. On the left is the, you know, the blood lead data, right? And you can see yellow is county. I think there's only one state that actually has it at the census tract, but look how many states we have no data, right? No publicly available data. And then on the bottom right is looking at kind of all the environmental exposures that have lead. And so kind of in the circle in the middle, I know it's kind of far for you guys here, is this lead and occurrence tool that EPA has called POST. And that's something that is available for local governments and EPA. It's not out to the public yet, but it's originally was focused much more on enforcement. So I don't think public health departments necessarily were using this data source. So that's another push that we're trying to do to connect this data to people outside of enforcement. And so that same data we're trying to pull into the mapping that we're doing. And so we're going to continue to do this work over the next year with our, you know, people that are, so it's trying to figure out how do we get this data? How do we get it all together? How do we start to get states data, which is a little bit more granular, right? How do we, right? Because sometimes the EPA data we get is kind of, it's too high. So it's hard to see. And we know with lead, it's local. It's like it's really close, right? You can't see it if you're too high up.
Can I ask a question about, because I'm very interested in operationalizing cumulative impact. And so impacts, so you're saying census, so if someone has census tract level data. Is there a way to, I guess in Maryland, what's the smallest level that we have data?
So from a health perspective, because this usually ends up, so a couple of things. House level data is actually available at the address level. So Maryland has address level data for most environmental measures because, especially with lead, we actually have property data through the lead rental registry. And so that's available at a point level. Health data, we generally, because we look at rates, denominators for populations are generally most easily available from the planning department or the census at the census tract level.
So you could lay over a census.
We do layer. So I just want to say that what EPA is doing, we've been doing for a number of years, actually. And that is to actually look at census tract level, our environmental public health tracking portal, which
Yes, you have.
it actually displays lead testing rates and lead level blood lead concentrations at a census tract level for the entire state.
But what I guess I'm trying to see, what do we need to do to bring in line with what I hear EPA is trying to do is really to move just from this compliance, sort of regulatory compliance, linking the public health data and coming up with sort of a dimension or a score or something that identifies hotspots, because our hotspots right now identify by address.
So
combined with occurrence.
If we can go to the next slide, it'll help. I think one of the things that I'm working on, and this is a blueprint paper that Valerie Zartarian's already published. We're going to be publishing one hopefully in January. I just worked on the manuscript this weekend that looked at places like West Virginia where we don't have robust blood data, right? And one of the things that we're developing, because they base this off of Michigan, so it's a blueprint of what's the problem? Let's look at the data. Step 3 is like, do we have blood lead data? Do we not have blood lead data? And then, okay, let's get some local knowledge. How can we address where we have these high risk factors? And we're developing a standard operating procedure. So an SOP to do this mapping that I'm going to show you next for Maryland. You could do it in Baltimore.
And I just want to make clear, this is not to step on EPA's toes, but we've actually done this already. We have discussed this. We've actually looked at, and part of the subtlety that this paper, because I've looked at this paper actually, and so the
This was just published
presentation.
in February.
This is really terrific work for states that don't actually have a lot of blood lead data. Maryland, I will say, is pretty well ahead of the EPA on this particular issue because we have been funded for a long time, both through MDE and through the Department of Health, to look at that data. We've actually looked at that data for a number of years. If you looked at, I don't want to spoil this, but if you look at where the highest concentrations are, where the highest blood lead levels are, and I've done this, with the high and something this paper hasn't done yet, which is one of the things we have done, is look at where is there relatively high blood lead level, but also relatively low testing rates. Because that's actually for me, that's actually for me, one of the endpoints that's most interesting. And we have done that. And if you look in Maryland, not surprisingly, they are in the black butterfly districts of Baltimore City, but they are also so East Baltimore, West Baltimore, around the center of the city, you can sort of draw a straight line across Route 40, and you'll see them in East Baltimore and in West Baltimore. But you'll also see them in Frederick, Cumberland, Somerset, and a couple of other places across the state. So that is, Senator, one of the things that I think is of great interest to us here in the department.
Well, right. So obviously the chair invited you to.
Sorry, we didn't need to go ahead.
I'm just trying, again, I'm jumping in and I'm 60 days before session. So if there's an opportunity to actually do something, I want to do it. So that's what I just wanted to hear. So in terms of the change, the innovation, like the cumulative impact, what are we doing? It's like we got the data. So I was a researcher too, got it. How do we turn it into policy? How we use it to make our people healthier, right?
Yeah, I think one of the things, if you go to the next slide, so one of the things I think that I'm finding, this is what we just talked about. So you could skip this. This is the national map, right? Which is the paper that was published. You can go to the next one. That there's opportunities for the health department to work directly with EPA in a different.
That's one, Wendy.
You know what I mean? Because I'm working with the, other health departments that I've never talked to before, because I only talked to one particular part of EPA. When there's a lot more parts of EPA that we should be partnering with, right? I mean, the first time I met Cliff, I've been there for a long time, was because of ethylene oxide, right? But normally we're not having these regular conversations with the EPA part and the health department. Right. We're doing work now at the OEJ ECR looking at environmental health disparities. They will be coming out. Right. Like this is work that we want to look at preterm birth and low birth weight because of the environmental exposure. So how do we create better partnerships, right, to help, right, where we are also talking to people about very similar things, and we have maybe a little bit more control where we can push things on the environmental exposures, right?
Yes.
And so I think there's really good opportunities for health departments to work more kind of with their, and their state partners in environmental health and the regional partners, especially in Region 3. That's kind of partly kind of some of the work I've been doing in West Virginia, connecting with people that I wouldn't normally talk to, like with the chair of maternal, health.
Yeah.
Right. I'm having meetings every 3 weeks with folks in West Virginia.
Wow.
So this is just, and then I'll show you the other map. This is what we're doing in West Virginia. So because of Clarksburg, where we had a very similar Flint, Michigan, and I really got involved because I'm the only epidemiologist in the regional office. So I was doing air toxics, but of course I go into anything that has to do with CDC, and because I'm trying to figure out how to have them talk about data.
About premature.
That's a whole. And so in Region 3, when we were doing this, we were like, we need to figure out, this isn't the only place, Clarksburg, that the state secretary said, I know there's other places that there's lead going on. Like, let's figure this out. And so one of the main things that we talked about is right there, that first bullet under step 1 is, what are the highest risks of lead exposure and where are the lowest testing rates? And Cliff, I have to tell you, I'm the only one for the last 2 years at EPA that's been talking about testing rates. Because I don't care about elevated blood, but it's so biased on how they're selected. It doesn't help me.
Yeah.
We need to chase the elevated. Yes, we need to figure that out.
Yeah.
It's not a tool we should use. And I said it in 2019 to Valerie, but she didn't listen to me at the time. Me and the CEO, like, no, testing rates.
Oh, yeah.
So they can't use that data. It's not helpful for prevention.
Yeah.
Right. It's individual. We have to chase the elevated blood pressure. This is kind of what we're doing in West Virginia to kind of to scale it. Right. So I think, again, another opportunity for Maryland to kind of also highlight, hey, we've already been doing this and make this a national model.
Yeah.
Right.
And I'd also be interested in hearing what we're not doing, because we still have a problem. We have problems with under testing. We looks like we initiated something around testing, but maybe we need to build out that section of the code. About how it happens, who does it, what happens when,
These conversations we're now finally having at the national level with our Children's Health Program, because we brought it up because we've been talking about this project. Because in West Virginia, the average testing rate is 20% statewide. And it's mandatory. It's been mandatory for everyone to be tested for 3 years. So
and how do we
do it? Work.
Under
Testing rates.
We're under 30%.
So to be clear about that, Fred, because I think that breaks down in various categories, right? So the under 30 is for everybody under 72 months, right?
Exactly.
So as you know, Senator, it's mandatory for all children on Medicaid. Actually, sorry. In 2016, we made it mandatory for all children in the state to be tested at ages 1 and 2. And so if you look at the Medicaid testing rates, the highest we get to is probably in the Medicaid population somewhere around 60 or 70% in year 1, It drops in year 2. And if you look at the non-Medicaid population where we have much less data, it's probably significantly lower than that, but we looked at testing rates overall across the entire state. And it varies probably a high, as I would imagine, somewhere around 65% in Baltimore, and some of our older jurisdictions where there is higher risk to probably around 30, 40, 20% in some of the rural jurisdictions, especially that are the newer housing areas where there's less incentive historically.
Right. So there's room to improve. And I will say though, out of the region 3 states, because I spent the last 2 years looking at testing rates, Maryland's you have the highest in our region, right? Like, so, you know, when you look at, like, we've been looking at this. And so one of the challenges we also have nationally, working with Brian Kennedy at the CDC, is we only have 11 states that have universal testing, right? And so I'm trying to push CDC to look at, try to do a national testing rate. How can we talk about testing rates regardless? It's just an equation. How many kids did you have and how many were tested, regardless of what the rules are, to start the conversation.
One other thing that is of interest, when we went to universal testing in 2016, we actually looked at how many kids we identified with elevated blood levels when we increased our testing rates. We overall increased the testing rates in the state by an average of about 10 to 12% when we went to universal testing. Didn't get everybody, but we did significantly increase testing rates. Interestingly, though, we did not increase the number of kids we identified with elevated blood lead levels.
Right.
And what's significant about that is that clinicians clearly recognize, for the most part, when they need to test for a child with elevated blood lead, even in the absence of a mandatory testing requirement. So it was reassuring for me, as the holder of those regulations, that the clinicians appeared to do a good job of recognizing when kids did need to be tested. What we were missing, particularly now, is kids with subclinical levels of lead exposure, 3.5 to 5, particularly in areas that are not traditionally thought of as at risk.
Right. Yeah, thanks, Cliff. Can we go to the next slide? Again, this is what we were focusing on. Again, originally we got testing rates, right? Although in the original paper, they talked about testing rates, but they didn't really talk about it. Like, there maybe was a sentence because I wasn't involved in that paper. So I'm the one that really was like, we got to do testing rates, we got to do testing rates. And so, and I don't know, you know, about the HELPS database. So like the data was a mess, and I was working, it took me about a year, believe it or not, Cliff, to get Sharon Hill, who was the director there on the FE, to kind of say, oh, like I'm trying to connect environmental data to testing rates, but she didn't really understand the environmental data because that's not her job. And then it finally, you know, if you show the next map, the next slide, she got it. And she gave me all of 2023 data that she had 2 new EPIs that she just hired, and they used that as a training session on how to clean the data. And so the map on the right, if you see the darker counties, the darker it is, it's between 5 and 12% testing rates. And the highest is 39% or 33% or something, which is white. So you can see West Virginia is having a hard time. There's a lot of like less than 20% or 10%. And on the left are the 5 indices that Valerie's Arcturian used, which is the HUD index, EJ screen, the ROX model, the Schultz et al. Blood modeling, and the random forest model, right? So they were using multiple indexes that all kind of measure age of housing, how many kids live there, and they did a statistical analysis to kind of say, how well do these work? Some of them worked better. Some of them worked better combined. And so this paper where you see the colors, they did kind of 3 different statistical analysis, top 20%. They did a get us all, model that basically clusters how many places near where you had a hotspot, how many. So in West Virginia, that's probably not a great model, right? Because we don't have a lot of people that live there, but still, and then you can see that bottom one is kind of where they both, which is the black, where they both overlapped. But when we see this and you can kind of look at those two maps together, and this is when the health department is like, oh, yes, and look, Ohio County up top, we've already focused on them because we know the testing rates were low. And look, it also has all this high risk of housing.
Yeah.
It's completely started a different conversation with how do we really, even though we were sort of having it, but we weren't, right? And so it's been pretty exciting for them, one, to trust me with, they gave us all the data. Right, at first, for us to map it for them, and then we kind of gave it back to them. Like, we're not holding on, to this raw data because it's not ours. And so another exciting thing that we hope, right, when the SOP comes out, that states can do this on their own. They can do this modeling to really look at, going back to what you said, Senator, where do we have these highest risk? And this is just really for lead paint and old housing. And we want to bring in those other parts of that ECHO tool that are going to talk about lead exposure in air.
Yeah.
Right. Can we go to the next slide?
Doc, before we leave off with testing rates, we did have a comment
I'm sorry.
from Dr. Mikowski. Did I pronounce the name right? Mikowski. That basically said universal testing was helpful in identifying lead poisoning children from recent cinnamon-related baby food contamination. We saw the same thing in our program, that the more testing we got, we saw more sources. So we saw all these other secondary sources that for physicians that wouldn't unnecessarily identify a kid that needs to be tested because they live in a property that was built after 1978. You see all these other sources that come up.
So, and to add to that, one of the things the models don't take into account, for example, is immigration status. We've identified a number of communities with higher risk, particularly in Prince George's County, Montgomery County, and some of the areas with high immigration rates, where we've identified clusters which are not based on housing at all, but which are based on either exposures acquired overseas and imported, or in some cases, they are consuming foods that are risk foods. So those would be spices and other foods that are acquired that aren't necessarily, that have high lead levels, or are traditionally using traditional products like coal or other ornamental products that also have high lead levels.
MTA bus route, do we check in the bus routes at all? Are bus emissions, car emissions, are there any links to lead?
The lead was taken out of gasoline.
Okay.
In the 1970s, after one of the most shameful medical practices of all time, which was the tetraethyl lead. But it hasn't been, it's now distributed traditionally along highways.
Yes.
Because it's still in the soil from deposition from 1950 to about 1977 or so.
So do we know, like, through MDOT or through our to what degree there are hotspots along all of our transportation routes where there's housing?
I think there's been some soil studies throughout the years, and I think that they did a recent one. Oh, she might not be online.
I'm right.
Recent soil study in Baltimore City.
There's one, I think, that Rapali Data out of Michigan has done 2 rounds of, but I'm not sure has published yet. And so the old studies are there, but just for the lead and gasoline phase out went all the way up until 1996, mainly happening by the 80s. Cliff, paint was 78.
Yeah.
Solder was 86. But I can find out on the what the Michigan Technical College did on the lead and soil recent studies. But when we did the early studies on Baltimore, Cincinnati, and Boston, we had relatively low rates of lead in soil.
Okay, so issues, because I also very interested in air quality, so, so lead is not, but I guess so in my district, so the hot spots, the hot spots for lead are along the York Road corridor. You talked about the 40, but I'm going to, say, Route 40, State Road 45. That there are quite a lot of hot spots. I just want to look at that. And so just curious about, all when we're going to develop cumulative impact, these areas would be sort of prime pilot areas of, operationalizing
And I think
cumulative impacts on the community. So that's why I want, and if this is an opportunity of this issue or look at or as an opportunity, I'd like us to explore it.
Yeah, Mary, I think I've been concerned that most of the soil studies have been around residences, right? But don't hit play areas, don't hit areas where people are, I have a concern around the incinerator and what it's blowing off into Cherry Hill and what's the other community? I can't remember.
Westport.
Sorry, Westport.
Westport, yeah.
And I would imagine, I just imagine if we sample soil there, we're going to find some extraordinary levels, and I think we should, because that's carrying into those communities. So I think this is something we ought to look at as a commission, for sure.
Busty post.
Yeah, so Mary, I do have a comment, and I don't know where all your small airports are in Maryland.
Yeah.
But that's a real issue that EPA and FDA have yet, that they did the endangerment finding. And there's studies that, we've had places kind of all over, small airports, they use leaded gasoline. It's the only leaded gasoline, like the NASCAR just stopped a couple years ago. They were still using leaded gasoline, but small piston airplanes, golf carts.
No.
But those, so I think when I looked at it, we had 1,500 small airports in Region 3. And most of the time they're flying over people's houses when they land, and they're giving off lead.
Yep.
And they dump fuel.
And they dump fuel before they land. So that's something that, for an air perspective.
About it. So MD, this commission, whatever, this, at least raising it.
Because the endangerment finding's been completed, so you don't have to get the evidence. The evidence is already done.
And Senator Lamb is focused on sort of sound issues regarding the airports, but not lead. I think that he's a physician, Hopkins physician. So I do think this is something he'd be interested in as well.
Yeah. All right. Yeah, thanks. And so this map is showing you all the different sources. The top on the left is age of housing. On the top right is just lead in surface water. The bottom right is mining, because the state was interested in mining. Again, we're trying to make the states be able to look at the data that's important to them. Wendy, is there a way to zoom in on the top middle map?
You just click it. Can you unpin the thing at the bottom? Fred, can you unpin our thing?
What page? What page was it?
There you go.
One page up.
Right here. Come on. Whoops, I'm clicking on the wrong screen.
Yeah, right there.
Okay, let me. No.
That middle map on the top.
Here we
go. The reason I want to bring it up, Senator, is if you look at the number of little one over. The one with all the crosses. Subscribers.
Oh, sorry.
3 people right there. If you look at all those little X's, that's 0.05 tons of lead that's emitted. And I'm really tired of us talking about tons, because that's 110 pounds of lead being emitted into the air every day, every year, small enough to not only contaminate soil, you can breathe it, right? So this has been, and I fight with EPA. They're like, well, there's not a lot of studies, because we don't collect the data You need air. So it's hard to do an epidemiological study if you don't have air data, right? And so I didn't do this. This is just the NEI. Like, this is the stuff that's in ECHO and that post tool that I think you put this with low testing rates or elevated blood leads, then there's actions to be taken, right? Because anybody that has less than a half a ton of lead, there's no controls even required, right? So I come from lead air toxics.
Yeah, sure. No, that's, yeah.
And so this would be something that, you can do, or we can do in Maryland, right? Where are these? I don't know if you have as many as West Virginia, right? But they're small shops and these small things, there could be a daycare center next door. We don't know, right? So going back to Paul, there's a lot of sources that we're not accounting for.
So I guess in our state, I guess it could be a combination of the health, MHE and MDE, but to what extent are states authorized, to act? In other words, there is, particularly when it comes to permitting, et cetera, there's a going back to the EPA, and of course, there's no science and all that. So I think our local states have felt that they can't introduce what they know and their knowledge to override what EPA. In other words, EPA sets the bar low, and so our states authorize to have.
Depends on the state. Yeah, West Virginia is not.
Yeah.
I don't know, most states can do more, right? But one of the challenges, I think, going back to cumulative impacts, where I think allows us to start to have this conversation, is for us to kind of have that conversation, right? To say, can we do more, right? If we have children that are elevated, do we have, and be like, hey, what's going on with this permit? Let's think about this permit now as it comes up. So there's opportunities to coordinate with to figure out where, because that's just NEI data, right? Maryland, they have it. So this is, we have access to this. So there's, I think, opportunities to start to really address when we're thinking about exposure to kids, because there's because this is just recontaminating the soil, right? So even though, because when you think about this many years later, that dirt would have already covered it up and it would be pretty buried. Like we think about sediment, right, in rivers, that once you start disturbing it, it's really much more polluted the further you go down, right? But we still find really weird hotspots of lead. Some of it's still legacy from incinerators that are no longer there. People don't even know there was an incinerator.
Right.
We have, things between, 100 parts per million and 8,000 parts per million just in Philadelphia. So the range is it's really crazy. But one of the things EPA is trying to do, because there's some national data sets out there that look at soil data, that all the data that's been collected, including soil shops. We did that in Philadelphia, and I mapped it with the University of Pennsylvania. So hopefully there's going to be some real opportunities for us to continue how to have to do research, right? Because again, we need some of that research and data to do some of the research on, is this all really legacy? Is it all really from lead gasoline from that many years ago? I don't think so, when you look at how many lead sources just in the air, right? And some of the, so there's not a lot of ton of really big lead sources anymore, right? But there's a whole bunch of little ones. So I think there's opportunities.
I guess just to close this out, so the connection between air and lead when it comes to air and land, air and soil, I don't know that connection is as clear in our state in terms of our policy and our regulation and our permitting requirements. So to me, that seems to be something to explore and look at and learning. I know I know you all have been working for a long time. Just hopefully some fresh eyes are providing some.
Well, and there's space here, because I think these conversations.
This is an amazing set of conversations. We're going to have to probably move along a little bit. We have some other business, not much, but small business to do with the commission before we adjourn. And I just want to make sure we get to it. This is amazing. You can come back every meeting and it'd be great.
Yes.
All right, we go to the next slide.
We want a briefing. Okay.
Yep, you need a briefing.
And this is,
I think our committee
exactly
needs to be briefed on like, because a lot of us were not on that committee when the laws were passed. Also, things are changing. Interdisciplinary approaches to public health are really, I think, finally taking shape. And then we also have our Maryland Commission on Health Equity, which I would certainly, I did not see lead in our part of our sort of what we're working on. But given given the places where I hadn't even thought about where lead is being distributed throughout our population, you know, I would think that is something the health department, that we should look at. So
Yeah, Mary, let's talk
so let's
about that.
follow up. Yes, let's follow up.
Yeah,
So real quick on step 5, one of the things we did in West Virginia, we did do 2 non-competitive children's health grants specifically to go into providers' offices and interview them. What's stopping you from, sometimes it's the parents, they don't want to do it. They don't want to do the venous test. In West Virginia, they didn't have capillary testing, or they don't have a phlebotomist because it's a rural area. So they give a script. Never happens. The schools ignore that there's a box that they're supposed to check. So there's a lot of, we worked with the pediatric environmental health specialty unit also to work and train nurses and building partnerships down there in West Virginia University. So that was something we did last year, and we're still continuing to make those connections. Next slide. So this is good. We're going to continue to work on the mapping. And again, I have a paper we'll be publishing kind of, so I think that SOP will help try to look at some of that data and or maybe support some of the work that you're already doing. Next slide. All right, so we have a memorandum of understanding. Do this really quick. We did this in February, working with, you can go to the next slide, working with CDC and HUD. It took 2 years. You know, I had two children during the time it took basically to do this. It took so long, but we got it signed. And you can go to the next slide because it's one of the, because I want to go through this quickly. One of the things that this is not a data sharing agreement. And trust me, you should have thought, well, because we called it a data sharing MOU because we're trying to figure out how to, CDC doesn't use our EPA data correctly. Like we're not talking, right? And we found out in Clarksburg, we did all come together because we needed the CDC partners. We needed HUD because it was a crisis. You know, there was lead in the water and we had people who were still drinking it. They wouldn't accept the pictures. Like people were refusing to take the pictures we gave for free. So we were like freaking out. Like, so we knew this was an issue. And so you can go to the next slide. And so we're working together. And one of the things that we're hoping to, and you'll probably hear the pitch from Brian Kennedy at one of our meetings when we're going to talk about it, is data standardization for lead. Right? There is no data standard. Everyone reports it differently. And from a national level, that's a problem from a surveillance perspective, right? So that's an opportunity for us to do something that help us share our data better. Because again, Maryland does it great, but when we're thinking about it at a national level, it's hard to kind of get that research, get that study when everyone's reporting things a little differently based on the grant requirements, right? The CLIP program wants it one way. And so it's kind of a challenge, but that's one of the things.
Carol Ann, I'm going to contend to you that EPA should send a charge letter assignment to the Environmental Protection Agency's Children's Health Protection Advisory Council and ask us to do a response to a charge letter on this topic. I think it would be really quite important to address this standardization.
I will bring that because, you know, you can go to like maybe 2 more slides. So because we did this MOU under the President's Task Force for Children's Health, the lead subcommittee, we have a new subcommittee called Data Integration that I'm the co-chair with, hopefully with Brian Kennedy. We can't get the CDC to give us a co-chair yet. And this is one of the low-hanging fruit that we think we can talk about is how do we get like a small group of folks like Cliff to kind of think about what that would look like at a national level. Right? Because we do have some states that do this very well, but how do we have a conversation to make sure it would fit for everybody, right? So some health departments that don't have a large staff, like, so what would that look like? And so there's some of the things that we're talking about. And the other thing that we're really looking at is how to talk about getting those rate numbers out. Can the CDC start talking about an EPA testing rates as opposed to NHANES data? Because it's not helpful. and I've been saying this for many, many years, stop showing this data. It says we fixed the problem and we didn't, right? So,
Yeah, because
so
we
that's
don't know.
It's true.
so that's another part of the data. And how do we talk about our data differently so that that can help us take action to do something? And so if you want to just go, I think there's a couple more slides. Again, you know about this. One of the things we did last year in West Virginia is I bought capillary testing kits for West Virginia Health Department. I got EJ money. I figured out how to, I just asked and they said, okay, so I bought it. I bought all I bought everything, gloves, and we gave them to West Virginia and they decided to give them to WIC centers. You can go to the next slide.
Very good.
And so they, kind of did this on their own, used our testing kits, but had a little subcontract for them to do it. And the testing rates went up to over 40% in Harrison County. So they've done it in 3. So apparently, so this is something, then we gave it to Wilmington. So working with the health department, I kind of forced my way into a meeting with the, lead restoration stuff. And they had a partner, a community center that does daycare, to say, we would love to do testing here. And so I dropped that off last month to support them to be able to have their child, because kids were coming in and they had to say, you can't come, you have to go to the lead test. So a really great partner in Wilmington. And then I gave, a couple to, Ruth Ann and Cliff.
I actually have those. Yes.
And so, we're trying to have this different model of how can we use funding, and it's making a difference.
Yeah.
Right. The WIC program at West Virginia, the chair of her department is willing to train anybody else in any other county how to do this. I'm trying to find funding. I'm working with our lead funding. We only do it out of this like lead restoration, whatever. I'm trying to figure out how, because it doesn't say they can't buy it. So I'm trying to figure out, how do we already have funding? How can the EPA give that flexibility to the health departments if they want to, and if they see a need to purchase that equipment for their local health partners. So that's some of the things that I think is kind of new. And one of the things that Kurt had said in what Delaware, he's like, EPA has never done this before. And I said, I'm a horse of a different color. So I will try to find solutions. And I think we need to kind of be creative, and because it didn't, so that's where I'm trying, how do we make this sustainable? Right? Because we're showing real success, and I'm trying to figure out, so with any help, how can we, because it's not expensive. It was like $5,000 for, with 400 tests and a kit. So it's not a lot of money, especially at a federal level. This is kind of, but it really can make a big difference in testing. Okay, I think that's all I had. And just happy to kind of help, and thanks for inviting me, and I'm sorry I took too long.
You didn't. No, not at all. And I love the engagement, and we want to use these as opportunities to think about best practices for Maryland families and where we can do that. So really appreciate it. If there are more questions, please get them to Wendy, who can compile them and get them to Carol Ann. Carol Ann, I look forward to continuing to do a lot of great work with you, and I will ask you to please share that Thriving Communities grants with your folks that you're dealing with in Clarksburg and other parts of West Virginia, be with West Virginia State today. Yep. So I just wanted to see, Wendy, first of all, could you pull up the agenda? Thank you everyone for the engagement there. But could you pull up what is next on our agenda? If we have is next. Okay. Before we get there, if I could, because I'm going to have to step off a little bit early and turn this over. I wanted to just have Wes Stewart quickly give an update on the rule release last week. Caroline, I don't think covered this, but the rule release on lead dust standards, just the final rule release from EPA.
Sure, Wendy, if you're able to pull that up. But just the EPA released its final rule, as Ruth Ann mentioned, on lead dust, pre-intervention hazard standards, and then also post-intervention clearance standards. These were proposed last year, and they'll go into effect 60 days from the date of publication of that final rule. These have significant implications. The most important one is on what we call the dust lead action level standard.
Next slide.
Next slide. So this is pre-intervention, and in the past, we had levels of 10 and 40 for floors and windowsills, and now EPA is setting that at any reportable level as measured by an EPA recognized laboratory, and those are typically NLAP and LLAP recognized laboratories. So there's essentially any detectable level by a recognized lab is going to be considered to be hazardous and can trigger action and responses as a result. So that's a very significant change. And then the next slide, in terms of clearance, where work is undertaken that disturbs paint, where you have lead abatement practices that are undertaken, the lead dust clearance standard is also lowered from 10 to 5 and from 10 to 40, most particularly for floors and sills, and then for windows wells to 400 down to 100. So again, these are significant improvements in the lead dust standards. Just want to make sure everyone's aware that will be going into effect within the next 2 months. And Fred also may have additional information on MDE's plans as well.
Yeah, so we looked at data for the last couple of years, and we saw that about 30,000 of the inspections that we had done, or the third-party inspectors would have done, wouldn't have passed under the new standards. So we're going to be busy, and we're going to be the public's going to be busy too, getting up to the standard and making sure we reach those levels. So.
Fred, that I think we can help with that, but it does seem to me that given that if there is a governor's supplemental budget opportunity, this is something that has now been moved into action, and MDE will need significant training to do significant training and help with re-clearance, right? Getting contractors to this place, enhancing training across the state. So I would urge potentially that MDE, if it hasn't already carved that out in its budget, think about this. It is something, an opportunity too, for all of these. I mean, whether it's a child care facility or a home, we're going to have to really make sure people know this. This is part of the pathway of no safe level for lead in the human body, and trying to advance that federal standard. It doesn't quite get there, but it's a long, big step there. So I just urge that we look at resources, or that we collectively look at some grant that will help us get this really as an educational practice and model around clearance, because 30,000 failures is a big deal.
Yes.
And it's a big deal. And it opens up liability for those on the business side of this. And so I think that, on that side, I mean, the first and foremost is the protection of children, and the protection of pregnant women, and the protection of adults in general from ingestion of lead dust. But this is a big deal.
Ruth Ann, what are the, and I apologize, I don't know, what are the reporting requirements for the commission, or do you provide a, annual report and then recommendations for legislative action or budget?
Well, I think that's where we need to strengthen here, is getting recommendations for legislative action on some of this. We do occasionally send letters of support, but really making requests as often are going through MDE. The commission and MDE should think more about that. We do have an annual report that comes out that honestly, something I've been thinking about is it takes a long time to do all the epidemiology on the data and all of that. So the reports come out pretty late often. Fred and Paul have really improved that. But I think there ought to be a policy report that comes out much quicker. And I think with a higher, now that we're getting all of our seats filled again, we'll be probably able to take more action on that.
Well, I do know that this requires operating. So I actually, and this is a new, a federal requirement, a rule change. So the agency, I'm not sure that, well, budgets haven't been finally approved. And they won't be approved ultimately until the governor presents his budget in January. But rather than looking for a supplemental for this, because this seems to me to actually require operating, salary positions, and there could certainly be there could be a startup, ramp up, and then you could propose a sunsetting on it so it doesn't impact the budget for, more than whatever, 4 or 5 years or something. But to me, it definitely would seem, because we already don't have enough people to do the work. So, this definitely requires, you got MD and MH. I mean, I just really think that this is a special situation where it would be great if there are if there's federal money, we really can't rely on it to be like a multi-year thing. So we would have, certainly maybe to get it started, but we would have to figure out, I'm repeating myself. I think you get the right. It's just that I'm no, you're new. Well, no, it's more of that. I have a really more improved sense of the urgency and the importance of this in our environmental policy, and it's not something I've heard us discuss since the time I've, been on the committee. So, I mean, there are these occasional bills and touching around the edges, but a significant focus on policy and funding.
Yep, I think
and programs related to air and land quality around lead and some of the other contaminants, I think. Needs to be.
The soil testing right around those airports, around the smelters, that's got to happen. This is such a practical thing that has, for even MDE to look at those 30,000 failures, right, and be able to respond and be proactive. So I'm going to say department, if the department doesn't want to put it in, I would be happy to sponsor it, but it definitely, in terms of that requirement of doing the testing, but the thing about how does Maryland come into compliance with the new guidance, I think really has to be, in fairness also to our so it's not just an education, so we can't just hire. Well, this is also
contract out. It requires some bigger.
HIC should be doing trainings. I've always thought when people are getting their licensures, there should be a portion of training that happens there. So let's talk offline about this, circulate this. But I think that I just wanted to raise this very.
But you could have really community ambassadors.
Exactly.
Yeah. So.
Great. So I wanted to do that. I also want to take a moment. I don't know everybody that's on the phone, but I wanted to take a moment to really thank MDH, MDE, and DHCD, and all of our partners, my own incredible team at GHHI, and others, community partners, Baltimore City, Baltimore County, and all of the counties across the state. We had a really great lead poisoning prevention awareness week. We are really grateful for the incredible work in my shop that was led by Shadi Musa and so many others, Wes, and we had Johnette Richardson and others on our team. So really appreciate that. We're going to have a lead is every day, not just a week approach to this, of course, but I wanted to take a moment. I've been so busy traveling and working on some other projects that didn't have a moment to just say thank you. Thank you, Cliff and Paula and everybody at MDE and Nicola at DHCD. But really just great efforts. Thank Prince George's County also for hosting a really great event. And sending, I think, Wendy Boone off close to retirement there, but really just terrific. And wanted to say we need more of this community education around things like that are happening on dust levels, around the importance, and around this is not a done deal yet. So I think so important, and also to EPA, CDC, HUD, who were a great national campaign, always helpful. Really grateful. Also, EPA donated to GHHI 3 full sets of lead testing kits, and we appreciate that you were able to squeeze those over for us. We're putting those to use in partnership with the state and local agencies. But not enough time in this world to say thank you and take time to really point out just great partnership and great cooperation on that. Next year we'll clearly be doing 43rd District of Maryland and getting out in all the places we can. Also, and thanks to Young, Gifted, and Green for being a part of that press conference, and with Councilman Mark Conway on the lead service line, and doing a lot of work in that aspect. We are really committed, Allie, to make sure that for every child we can prevent from getting poisoned, in your child's honor, that we do that. Wendy, I know we want to move to
Ruth Ann?
Yes.
I'm sorry, this is Cliff. Can I just say right back at you, to your team?
Now, my team's spectacular. They're great. And the energy that Shadia and Angela and Carly and Yannette and Celicia, you name it, that they're all bringing, Johnette, our comms team, love it. I mean, they're just amazing. And Wes, of course, in that. So thank you. But let's go to the next things. And Cliff, as I do, I may have to, if I have to leave early here for this other meeting, kindly, if you'll take the wheel. Thank you.
Happy to. So why don't we start with updates from MDE?
So there's been a lot has been said. Lead Week was great. We also are working with EPA on sponsoring a lead workshop in July of 2025 for Region 3, geared towards professional development for all the lead programs in Region 3 and the professionals in the field. So we're having conversations about that. We're working with AIR just to piggyback on some of the things that were mentioned on they identified a case in California with airports and lead poisoning. So they're taking the lead on that, and our epidemiologist is doing some testing around the airports in Maryland. So that's kind of going on as well. And we're working with our water service administration on lead and service lines, and Mangela's been helpful with that. With getting information for daycare centers, and we're helping out with some testing in the homes as well. So we got a lot going on. We got a lot of enforcement action. We have submitted just in this first quarter, submitted 2 recommendations for third-party inspectors to lose their accreditation. So this is probably the first time we've ever done that. Mm-hmm. And so we've been successful. And so we're going after some of our bad actors, if you will, out in the communities, but we've also been enthusiastic. Our compliance efforts have been increased. About 95% of our rental property owners were in compliance, and so we're happy about that. And we've been doing a lot of conversations with property owners on the phone about what they need to do to stay in compliance. Ms. Watson.
Are there fines associated with any of this?
Oh yeah.
Okay.
Yeah. So just to update. About a month and a half ago, we sent out 14,000 notices of violations.
And do you know how much revenue is generated from the violation? Is that I guess that's a rhetorical. It would be interesting to find out how much revenue is generated.
So I can tell you how much we've collected in the last 6 weeks.
Okay.
About $1,140,000.
Does this all go to the general fund?
I don't know what.
Special fund, it goes to lead special fund.
Yeah.
The million is rental registration.
Yes, it's rental
It's
registration.
not necessarily, we have an enforcement and compliance report that we do.
So fines, of course, I'm just thinking about.
I can-
On your.
I have your email address. I'm gonna,
Talk to my chief of staff.
okay, and I'll make sure you get some things
Mhm.
that I know that you're interested in.
Yep, and then we can have a plan, a discussion for a plan.
There's a history behind fines, so we've been trying to increase it.
I know you put a bill in to do that. So I feel like this can help with to allow that to happen.
Okay.
Also, there's going to be some other revenue enhancements in light of things. So might as well pile on. Okay, all right.
All right, thank you for the discussion. Thank you, Fred and Paula, Senator. Moving on, I can provide a brief update on the Department of Health. As Ruth Ann mentioned, we obtained from GHHI courtesy of the EPA. Thank you very much, Carolyn. 3 lead care 2s. Those are capillary testing machines. And so what we are going to be doing is working with our local health departments. My plan is to make them available to local health departments, particularly because Baltimore City already has lead care 2s that they have been using for a while. I'm going to try to get these out to some of our more rural jurisdictions with higher lead levels and lower testing rates and I will do this in cooperation with the local health officers who will be allowed to basically ask who's interested across the state. And I'll try to use these to increase testing in some of our rural jurisdictions, and very much appreciate the collaboration with EPA on that. Otherwise, we've been working very closely with MDE on all aspects of lead. We are also in the midst of looking at our data more closely historically, and we are about to update our environmental public health tracking portal to show the history of our home visiting program recruitments into the home visiting programs in our 11 jurisdictions that have the highest lead level, the highest number of lead exposed or children with asthma across the state. And so when we revise and release that publicly, people will be able to see how many children have been served by local health department home visiting programs across the state. I'll stop there and turn it over to Paul Rogers and Mike Ikniowski to talk about the Academy of Pediatrics.
Yes, I would like to just mention that serving on this commission has been the highlight of my medical career, which is almost 50 years now. It's been an honor working with all the people, dedicated people on the commission, and I applaud your service. It seems like we're short supply these days of people really stepping up the plate and serving. So I really applaud what you're doing to keep up the good work. And I'm officially turning it over to Michael.
Hi, my first meeting on short notice. I don't have a lot to report on, but having spent my career as a practicing physician, I will say that capillary testing is an absolute game changer in terms of rates of testing that you can accomplish very easily. They were very readily accepted by parents for testing kids in office. The number of kids we were able to screen compared to sending them to a lab with a lab slip, it's just incredible how much more you can do. So if there's any policy measures to get more capillary testing instruments into the hands of clinics and offices, particularly in areas of needs, I think that would be a fantastic way to increase lead testing locally or, through the EPA nationally. So I'll just put in a little plug for capillary testing and how well that works at getting kids' lead levels measured.
Thank you, Mike. Much appreciated. Mangela, are you here?
Yes, sir. I'm here. Good morning. I'm very excited to learn about this availability of the capillary test kits. So once it's made available to the local health departments, and if we get the list, I'll be very happy to share it with the childcare programs and also parents who are struggling to go to the healthcare providers and getting the test done to redirect them to the health departments. So that's a great news. Other than that, nothing else to report. Thank you.
Thank you so much, Mangela. All right, Benita, is Medina here?
No, I don't think Benita's in.
Okay. Nicola?
Hey, everybody. I'm here and Jack is here as well. Ruth Ann already let everybody know that we're selected for the award for HUD's lead hazard reduction grant program. So we're very happy about that, getting into the negotiation phase with HUD now and hoping to start implementing the program for lead hazard reduction early or mid next year. This will be our third lead program at DHCD, so we're right now in the capacity building phase to really ramp up the volume of households that we can serve, and we're revising our marketing and application and internal processes to ramp up for that effort.
Nicola, thank you. And I'm assuming that will have some implications also for the Medicaid CHIP program as well, if you alter some of the business practices or do some of that as well.
Right. We'll review all three of our lead programs to, find the synergies and the complementary components that they can bring to the table for a comprehensive lead abatement.
I'm very much looking forward to that discussion.
Great.
All right.
We have a question from Barbara Moore.
I saw that. Yes. So Barbara, the answer is there's no reason why the local health department should not be able to test pregnant mothers in the event that the lead care 2s are in their jurisdictions. It's just a question of doing the testing. Yes.
And I would say
That'd
from
be great.
EPA, this is Carol Ann. One of the things I'm working with Unicare, it's a healthcare provider in West Virginia, is we're trying to figure out how do we target direct messaging to OBGYNs in West Virginia who, even though we have it on the website, but how can we actually get direct messaging to them to kind of make it stick?
I'm happy to have a conversation with you about that and a couple of other things.
Yeah, that would be great because we're
All
still
right.
running into issues that obstetricians are like, nope, we don't need to test, mom.
Yeah.
So that'd be awesome. Thank you.
Thank you, Barbara. Nicole Hurt, do you have any updates for?
I don't think she's on either.
Okay.
Doesn't look like she's on. Anybody else there from DHCD, Baltimore City?
Hi, I'm here. It's Catherine Taylor.
Hi, Catherine.
Hi, how are you? I have, I guess Ruth Ann did mention it earlier about us being awarded for the 5.8 million from HUD. So we are also in our negotiation phase of just building our capacity to be able to tackle the new grant, including our current one that we have going now. But that is all of my updates for today. Thank you.
Thank you, Catherine.
Congratulations.
Congratulations indeed. Julie, are you on?
Hello, yes, I am.
Hi there.
No major updates. Just also wanted to thank everyone for the participation in Lead Week. We had GHHI come to our testing day, which was great to have them there. And then we are also in the middle of planning our next testing day. So I'll let folks know once we have that date scheduled.
Excellent. Thank you so much, Julie. All right. Wes, I'm assuming that we've heard updates from Ruth Ann already.
Yes, and just shout, I just want to give 2 minutes in case folks didn't get the Lead Week kickoff and press event, and then wanted to thank Prince George's County for sponsoring the event and PG. Do you want to give the 2-minute update on those two, Shadia?
Yes, hi everybody. So yeah, National Lead Poisoning Prevention Week was phenomenal. We had about a total of 120 folks come to our community day and resource fair, which was really great. Again, it was at Utah Median Park across from Baltimore Unity Hall. And I believe we had about 50 attendees for the press conference. For the event in Prince George's County, it was really well attended. We had about 60 attendees there as well. And throughout the week, we were able to reach 150 homes in Sandtown, Winchester to canvass for the Baltimore City Health Department's lead testing initiative on that following day. We also had 2 events at local Baltimore City schools on that Thursday. And then we were tabling at Zubu talking about, the Maryland lead and asthma programs, as well as promoting GHHI's services and programs. So it was a really, really great, robust week. Thank you all for your immense support. Thank you, Nadia, for speaking. Thank you, Cliff, for emceeing at the press conference. And of course, thank you, MD and MDH, for all of your support. It was a lovely event, and I really cannot wait for the next year. So thank you, guys.
Thank you so much, Shadia, and thank you for all the work making all of that possible. Any comments from commissioners or updates from around the table?
I have nothing.
I
guess I just wanted to provide a little bit of an update on the lead service line inventory. So on October 16th, DPW did submit the inventory for Baltimore City and County. It was not extremely successful. So there was a 93% no response rate for the inventory. So there's a little over 200,000 homes that are still of unknown material. There was, luckily, of the homes that were submitted, a little bit over 5,000, less than, I think it was like 0.03%. So 32 homes were identified with lead. Due to like ongoing advocacy and conversations with DPW, every home that is identified with lead is now getting a lead filter. Because originally when we were doing door knocking, it was unclear, like if a person tested and their house tested positive for lead, like what would happen next. So there is like this temporary remediation of the filter, which is great. But still a lot more to do. I think that the current self-survey process is quite complicated and confusing for residents. So I think that's partially why. We did a lot of door knocking. I think we reached over 300 homes in multiple districts with low response rates. And in talking to residents, there was a lot of confusion. A lot of folks like didn't know, just in general, a lot of things. So the next phase of advocacy is really trying to reach out to landlords who might have documentation that they can submit to the EPA, as well as plumbers directly.
Thank you so much.
I'm sorry. I just have a follow-up question because I want to be annoying today. I'm just wondering, why couldn't we just distribute filters as a primary prevention tool?
I would love that. That's what
I think there are a number of reasons for that. I've talked to water supply about that. But first of all, filters are a temporary solution. They require maintenance. They require changing on a periodic basis. And at the end of the day, the goal has always been to remove the source rather than applying an engineering control. As a short-term solution, they can be effective, but they're not a long-term solution.
I mean, is the plan to replace them, all the service lines, I would assume, and eventually, I'm just.
Well, I think I have a question for you because that makes me sad about 93%.
Yeah, so I'm going to recognize that it is 11:30.
Okay, sorry.
We are at time for the meeting, and I know people are always scheduled back to back. So and I see people dropping. So I just want to say thank you, Carol Ann. Thank you to the members of the commission. Thank you, Senator, for joining us in person. I would entertain a motion for adjournment at this time. I see one, I see a second. You don't know where I saw them, but they're there. And they are not debatable. So the meeting is now officially adjourned. Thank you all very much.